All right, thank you. And thank you all for being here today. This is the first time I've done a presentation where I could see everybody, where it wasn't just a webinar, so this is going to be fun. And thank you to the Bay Ridge Center for hosting this presentation. It's great to see everybody. I'm up in Park Slope, so I'm just a little bit north of Bay Ridge. And today I'm going to be talking about Medicare coverage in response to the coronavirus public health emergency. People might have a lot of questions about it, and I'll try my best to answer as many as I can, after the webinar. But because things are changing a lot, it's possible that either I won't know the answer, I might have to do some research or refer you to our helpline. So as I mentioned, my name is Emily, and I work for an organization called the Medicare Rights Center, which is a national nonprofit consumer service organization that helps people, older adults and people with disabilities, afford and access healthcare. We do this in 3 different ways. One is through counseling and advocacy. So we have a national helpline that's staffed with staff members and volunteers. We do educational programming, both for people with Medicare in the community, virtually now and less in person, but we also have educational programs for professionals. And then we have a team in DC that works to strengthen and protect the Medicare program. So today we'll be covering a couple of different things, and after the presentation you will know how Medicare covers services related to coronavirus, recognize changes to coverage rules during the public health emergency. You'll be able to list the actions that Medicare Advantage and Part D plans must take to increase access to care. And you'll understand how to enroll in Part B online and through local Social Security offices. And I have hidden the video, so I won't be able to see anybody. So if you do have a question, like make a note of it or write it down or something, because I won't be able to take any visual cues. So in the first section, we'll talk about Medicare covered services related to coronavirus. And first, just so that we're all on the same page, and to get us familiar with the different vocabulary I'll be using, I wanted to just review Medicare coverage in general. So Medicare as a program covers medically necessary items and services that you receive from either a provider who accepts original Medicare, if you have original Medicare, or is in network for your Medicare Advantage or your MA plan. One important thing to note is that MA plans must cover everything that original Medicare does, but they can have different costs or different rules and restrictions for how you access that care. Part of what we'll be talking about today is how some of these restrictions have been waived or have been temporarily removed during the public health emergency, which we'll be abbreviating as PHE throughout the presentation. And because Medicare Advantage plans can have slightly different rules and ways of doing things, if you do have one of these private plans, you should contact the plan directly to learn about its costs and coverage. We'll also be talking about how the different parts of Medicare cover the care you receive. So in general, Medicare is administered in 3 parts. We have Part A, which is the hospital or inpatient benefit. We have Part B, which covers your doctor, your outpatient benefits, lab tests, x-rays. And then we have Part D, which is the prescription drug benefit. Original Medicare covers Part A and Part B. So on your red, white, and blue card, it'll say Part A, hospital insurance, and Part B, medical insurance. And then if you need prescription drug coverage, you'll get that benefit through a standalone prescription drug plan. And that's offered through a private insurance company. It's another card that you would use at the pharmacy. On the other hand, some people choose to get their Medicare coverage through a Medicare Advantage plan, which is sometimes called Part C. Medicare Advantage plans combine your hospital, doctor, and prescription drug coverage under one plan. So you have one card that you're using. These plans are administered by private insurance companies, so Humana, United Healthcare, WellCare. These companies contract or work with the federal government to provide the Medicare benefits. If you have a Medicare Advantage plan, you still have Medicare. You're just getting the benefit administered in a slightly different way. So how does this all relate to coronavirus? One of the changes that Medicare has made to its coverage is beginning to cover coronavirus testing. So this is both the testing for an active infection and for the antibody test. It'll be covered under Part B of Medicare, so the outpatient benefits. As of April 1st, so a couple months ago, a doctor could begin billing for this test as long as it was provided after February 4th. One important thing to know is that there should be no cost sharing, so no out-of-pocket cost to you. That means a deductible, a co-insurance, or a co-payment for the test and the associated visits. And this rule applies to both original Medicare and Medicare Advantage. So regardless of how you get your Medicare benefits, you should not be charged any out-of-pocket cost for the coronavirus test or the visit. Additionally, MA plans, Medicare Advantage plans, cannot require prior authorization for testing provided after March 17th. So prior authorization is when a Medicare Advantage plan says, you need to ask us for permission before we will cover this service. In order to decrease barriers to care, during this time, Medicare Advantage plans cannot require cannot require you to ask for permission before it will cover the coronavirus test. At this time, there is no coronavirus vaccine, but Medicare, is thinking ahead to the future, and if one becomes available, hopefully one does become available, it will be covered under Part B, so again, the outpatient benefits, and it will also have no cost sharing. So that means you should be charged $0. You should not have to pay anything for the vaccine, a vaccine once it's developed. Prescription refills are another important topic to cover because a lot of people are looking to get advanced prescriptions, leave the house less often, have everything they need at home. Plans must cover during this emergency period, which is currently, there's no end date at the moment. Plans must cover up to a 90-day supply of a prescription when you request it. A plan cannot impose a quantity limit on a drug that would prevent you from getting a 90-day supply, as long as you have a prescription that covers those those 90 days into the future. And a quantity limit is something that plans use sometimes to restrict the amount that you can get at one time. So sometimes you may experience that you can only get 30 pills of a drug each month. That sort of quantity limit is not allowed to be put in place right now in order to help you access a further supply of your drugs. The only exception is for people who are taking certain prescriptions like opioids. At the pharmacy, there's usually a safety check or a safety edit to make sure that an unsafe amount is not given to you or given to the person picking up the prescription. That safety check preventing, a larger dosage of an opioid is still allowed to be in place, but that's really the only exception. Additionally, plans can relax restrictions on filling a prescription early. So, at this time, even if it hasn't been enough time in between your prescriptions, you can still you can fill it early if that would be more convenient, help you access your drugs better. But we recommend that you contact your plan just to make sure there aren't any steps or paperwork or other things that the plan might want you to do beforehand. Also related to Medicare coverage during coronavirus is skilled nursing facility care. So a skilled nursing facility, which is abbreviated SNF, and we usually pronounce as SNF, is a facility that you might go to after you're in the hospital to get more rehabilitative care. So, you've had a hip replacement in the hospital and then you go to a skilled nursing facility for continued physical therapy and other follow-up care that you might need. During the public health emergency, Medicare has waived some of the coverage requirements. So some of the coverage requirements that are normally in place are not being enforced right now, or not being, put into play. One, important coverage rule that has been waived is that usually, in order for Medicare to pay for your stay in a skilled nursing facility, you have to have spent 3 days as a hospital inpatient. However, during this emergency period, Medicare has removed this 3-day qualifying hospital stay requirement for people who, and this is Medicare's language, experience dislocations related to the public health emergency. So what does it mean to experience a dislocation? Some examples that Medicare gives, but this is not exhaustive. It could apply to someone who needs to be transferred to a skilled nursing facility, for example, because a nursing home was evacuated or a local hospital needed more room, and so it's sending people from the hospital to the skilled nursing facility. Or if somebody needs skilled nursing facility care as a result of the current public health emergency, regardless of whether they were already in the hospital. So somebody could go straight from home into a skilled nursing facility and have Medicare pay for it. This is not usually how it works, but during the emergency period, Medicare has loosened some of the coverage requirements so that people can access the care that they need. The second coverage change that Medicare made with regards to skilled nursing facility care is surrounding the benefit period. So a benefit period is the way that Medicare measures your use of inpatient hospital and skilled nursing facility care. It begins when you are admitted to the hospital as an inpatient or to a skilled nursing facility, and it ends when you've been out of the skilled nursing facility or hospital for at least 60 days in a row. So usually during this benefit period, Part A of Medicare covers up to 100 days. Days 1 through 20 cost $0 per day, and days 21 through 100 cost $176. Once someone's been out of a hospital for 60 days, so 2 months, or they've been out of the skilled nursing facility, those 100 days reset, meaning you have another 20 days where you pay $0, and then you pay $176 for days 21 to 100. Medicare recognizes that, being out of the hospital for these 60 days may provide a challenge to beneficiaries, to people with Medicare during the public health emergency. And so if you can't start a new benefit period, so if you can't be out of a hospital or a skilled nursing facility for 60 days in a row, for some reason that's related, to the public health emergency, you can get another 100 days of SNF care, of skilled nursing facility care covered, without having to begin a new benefit period. So how we've seen this happen in practice is perhaps somebody has been in a skilled nursing facility for 100 days. They can't be discharged because, one, they still need skilled care, so they still need physical therapy, let's say, on an almost daily basis. And they can't go home and have a home health care agency send somebody to give them physical therapy because they're at high risk for contracting coronavirus. In this situation, the beneficiary could make the argument to the skilled nursing facility that they should get another 100 days of care covered and be able to stay at the facility. If this is something that you or someone you know is experiencing, I do recommend calling our helpline, and I'll have that number at the very end of the presentation, because these rules are sort of confusing and some facilities are not quite up to date on how or what they should be doing. So I wanted to, share this information, but just know, if this is something that relates to an experience that you or someone you know is having, you can always call our helpline for more specific, specialized counseling. Moving on to a different part of Medicare coverage, we have home health care. Some changes have also been made to the way that Medicare covers home health care during the public health emergency. So usually to qualify for home health care, you have to be considered homebound, which means that it's very hard for you to leave the house, your doctor doesn't advise it, you need a lot of assistance when you do need to leave the house. With regards to coronavirus, that definition of homebound has been expanded. So now you can be considered homebound and qualify for care in the home if your doctor certifies that you should not leave the house because you have a medical condition that makes you susceptible or more likely to getting COVID-19, or you have a suspected or confirmed case of COVID-19. So normally when somebody is looking to get home health care, a doctor must write the prescription, must write the plan of care. During the public health emergency, the types of providers who can write this prescription has been expanded to include nurse practitioners and physician assistants. So if the doctor is busy, there are other types of healthcare professionals who can help you access home healthcare. Additionally, home healthcare agencies can provide more services via telehealth, which we'll talk about in detail in a moment, as long as those telehealth services are explicitly or specifically listed on your plan of care. So a telehealth service cannot be used in place of in-person services that are already listed on your plan of care, but they can be used independently if the doctor says that these telehealth services are part of the plan. Usually somebody is required to have a face-to-face visit with the doctor before Medicare pays for home health care. Now this face-to-face visit requirement can be met via telehealth. So Medicare Part B covers some physicians' services at home. So this would be, this could include services you receive from a physician or another provider like a registered nurse who visits your home. They can bill Part B and Medicare will pay for it, assuming you meet the, any other coverage requirements. Part B also covers some services that are not provided face-to-face with a doctor, such as check-in phone calls and assessments using an online patient portal. These types of services sort of fall into the category of an e-health visit or a virtual check-in, and they're used to assess whether you should go to the doctor for an in-person visit. They're not a full visit with the doctor, they're just a short conversation, a short check-in to see what further care is needed. And the reason I make this point about the virtual check-ins being short, partial visits is because telehealth services is a category of services that has been greatly expanded, and there's sometimes confusion about it. So telehealth services are provided during a full visit with a provider. They're not just a check-in, they're not just a phone call. Because telehealth services use telephone or video technology that allows both for audio and video communication. So you have to be able to hear and see both parties. Medicare, outside of the public health emergency, generally only covers telehealth in limited situations for certain people. But during this time, it has expanded coverage and access to anybody throughout the country in healthcare settings or at home. So there are no restrictions on, you have to live in a rural area in order to get telehealth services. Right now, they're available to anyone throughout the country, at home, at a doctor's office, at a clinic. The coverage has been expanded. Examples of covered visits include, but again, this list is not a complete one, hospital and doctor's office visits, behavioral health counseling, and we use behavioral health to refer to both mental health care services, like talking to a therapist, and substance use disorder services, so help with an addiction. Preventive health screenings can be provided via telehealth, and the face-to-face visits required for Medicare coverage of hospice care. These are just the ones that we included because we've been hearing the most about them on our helpline, but if you have any questions about what Medicare might cover with regards to telehealth, we recommend that you speak with your doctor. There are a number of providers who can do telehealth services. These include doctors and nurse practitioners, clinical psychologists and licensed social workers, and most recently, physical therapists, occupational therapists, and speech language pathologists. The standard cost sharing, so a co-insurance, a percentage of the cost of a service, or a set cost like a co-payment, may apply to the telehealth benefits, but your provider can choose not to charge you for these during the public health emergency. Usually a provider cannot make a blanket decision to not charge anybody for the out-of-pocket cost, like a co-payment for a service. but to encourage and facilitate access to care, providers are being encouraged during the public health emergency to not charge people for these telehealth services. The provider still gets paid by Medicare, but they just don't charge you for the remaining cost. And again, if you have a Medicare Advantage plan and you're looking to get telehealth services, I recommend calling the plan. There's usually a customer service number on the back of the ID card or your card that will have the number to ask about the cost and the coverage and see, what changes the plan has made. I also wanted to spend a moment talking about the technology requirements for telehealth services because I think there can sometimes be confusion around them. So as I mentioned, for most services, you have to have a technology that allows for audio and video communication. Legislation has expanded the coverage, of audio-only services for very limited telehealth services. So this includes counseling and therapy provided by an opioid treatment program and certain behavioral health care services. Guidance from the Department of Health and Human Services now allows, during this period, providers to use any non-public facing remote technology to communicate with you. So this can be something such as FaceTime or Skype or Zoom. Normally there are certain privacy concerns that would surround the use of online or virtual communication, but right now they're not being enforced, with the understanding that doctors will act in good faith and make sure that information is kept as private as possible and that they're using appropriate technology. And if you have any questions about the technology requirements for a certain telehealth service, we recommend asking your provider. So that was just an overview of certain services related to coronavirus that Medicare covers. It's not an exhaustive list. Medicare still covers all of the things that it normally does: hospital care, doctors, services, lab tests. I just wanted to point out ones that have changed slightly or have a specific relation to what's going on now with coronavirus. In this next section, we'll talk about coverage access during the public health emergency. So during any emergency, whether it's weather-related like a hurricane or a fire, or now during a public health emergency, Medicare Advantage and Part D plans must work to maintain access to healthcare services and prescription drugs for plan members living in affected areas. And so what this means for coronavirus is that these apply nationally because there's been a national emergency declaration. And, following the declaration of said emergency, plans must meet certain requirements, which we'll talk about now. So Medicare Advantage plans, the private health insurance companies that provide Medicare benefits, usually have a network of providers that you have to go to in order to get your care paid for by the plan and for you to have the lowest out-of-pocket cost. During the public health emergency, your plan, if you have one, must allow you to receive healthcare services out of network, and they must charge you the in-network cost for those services. So if normally your in-network doctor's office visit costs $20, during the public health emergency, if you go out of network, 1, your plan must cover the care, and 2, they must charge you that in-network amount, so the $20 that you would normally pay. You don't have to be receiving services related to coronavirus in order for this requirement to be in effect. This is something that plans must do regardless of, the type of care that you're seeking. They must also waive referral requirements. So normally a plan might have a requirement that if you want to see a specialist, if you want to go to a cardiologist, let's say, your primary care physician has to write a referral and send you to that cardiologist. During the emergency period, that requirement for a referral has been taken away. They must also suspend rules that require you to ask the plan for permission. So again, the prior authorization before you get certain kinds of care. So if failing to ask for prior authorization would raise your costs or limit access to care, the plan is required to get rid of that prior authorization requirement. Part D plans are the part of Medicare that provide just prescription drug coverage. And during the public health emergency, Part D plans, one, must cover formulary Part D drugs filled at out-of-network pharmacies. So a formulary is the list of drugs that your plan covers. Normally, again, with the same idea with a Medicare Advantage plan, there are in-network pharmacies where your drugs are covered and out-of-network pharmacies where you would have to pay usually 100% of the full cost. Right now, as long as a drug is covered by your plan, if you go to an out-of-network pharmacy, then your plan must cover that drug, and you wouldn't be charged the full 100% cost. Additionally, just again, to reiterate as well, that Part D plans must cover a 90-day supply of a prescription if you request it. There have also been a number of changes that have been made in the past couple of months that are optional. So these are ones that have come out of either recent legislation or reinterpretation of certain Medicare rules. And Medicare has given plans flexibility to make changes to cost sharing and coverage. So what this means is that if you're wondering what optional changes a plan might have made, it's best to contact the plan directly, because these things that I'm about to talk about don't apply to all plans. It's just the ones who have chosen to make these changes. So, for example, a plan can choose to relax its policies to let you get mail and home delivery of prescriptions when disaster or emergency makes it difficult for you to go to a retail pharmacy. They can choose to waive prior authorization requirements that would otherwise apply to drugs used to treat or prevent coronavirus, if or when such drugs are identified. They can choose to relax restrictions on refilling prescriptions too soon, and they can waive cost sharing, so not charge a copayment or coinsurance, for example, for drugs used to treat coronavirus. Other optional changes that a plan can make are related to disenrollment and mid-year changes. So right now, plans are being encouraged not to disenroll plan members who fail to pay premiums. And they can also extend the grace period for how long you have to repay those overdue premiums. Usually, after a couple of months of not paying a premium, a plan might disenroll you. Since it's very important, obviously, to have health insurance coverage during the coronavirus public health emergency, plans are being encouraged not to disenroll people who fail to pay premiums. They also have the option not to disenroll members who are outside the plan service area for more than 6 months. So this could apply to someone, let's say, who maybe was traveling in March and then decided to just stay put. They're outside of the service area that they normally live in, but because they felt it was safer to stay, the plan could have the option not to disenroll them, even though they're not living in the regular service area. Additionally, plans can make mid-year changes that would provide more generous or additional benefits. So these changes must benefit the people enrolled in the plan, sort of self-explanatory, and they must be offered to everyone. So for example, a plan could decide to get rid of cost sharing for certain services related to COVID-19, lower cost sharing for certain services, add certain benefits within the scope of the Medicare program. But again, each plan is going to be taking these changes, making these changes in different ways. So if you do have a plan and you're wondering what it's covering now, you should call the plan to find out. one last thing in this section that I wanted to bring up is that Medicare has announced that there's a special enrollment period that people can use to make changes to their Medicare coverage if the public health emergency prevented you or stopped you from making changes during another enrollment period. So I'll explain, what that means in a moment, but this enrollment period that you didn't use has to have occurred between March 17th and July 17th. So for example, every year from January 1st to March 31st, there's an enrollment period called the Medicare Advantage Open Enrollment Period, when somebody who has a Medicare Advantage plan can change either to a different Medicare Advantage plan or go back to original Medicare. If somebody was prevented from using this Medicare Advantage Open Enrollment Period, which ended after March 17th, so it's within that time frame, they can call up 1-800-Medicare and say, I was affected by coronavirus, I didn't get to use an enrollment period, I would like to make a change to my coverage. The beneficiary or the person calling should not have to prove that they were affected by the emergency. And this special enrollment period can only be used one time between, now and July 17th. So if someone does want to make a change and they think they might qualify for this enrollment period, they should be sure they know exactly what plan or whatever they wanted to switch to in order to get the best coverage. And if, this sounds like it might apply to your situation or to the situation of someone you can call our helpline for more counseling to talk it through, because it can be on a case-by-case basis. Helpful to understand it. Okay, last section, tips for Part B enrollment. I'm just gonna second, I want to mute myself while I take a drink of water. Okay. So last section, tips for Part B enrollment. And so this section is going to apply for people who are not already in Part B, as in boy, of Medicare. Oops. So right now, and as of the end of March, local Social Security offices closed to appointments with the public. In that time, they've been encouraging people to apply online if possible. Someone who has never applied for Medicare before, so maybe you just turned 65, you need Medicare Part A and Part B, can apply online at this link. You can also, if you Google Social Security Medicare application, you'll find it too. And they can submit the application online, and then it should be processed, in a couple of weeks. Recently, they've also added the ability for people to use what's known as the Part B special enrollment period online, which is, a positive change, because normally people could only use this in person, which was presenting some issues due to the closure of offices. And I'm going to talk a little bit more about the Part B special enrollment period on this slide. So what is the Part B SEP, or special enrollment period? It's an enrollment period you can use to enroll in Medicare if you, your spouse, or sometimes your family member recently lost the job that provided you with health insurance. So this is, sort of a common occurrence. A lot of people are working past age 65 when they become eligible for Medicare, or their spouses. They stay on the job insurance, and then they enroll in Medicare later once, they or their spouse retires. So if you recently lost health insurance based on current work and you need to enroll in Medicare, you can use Social Security's online form. And it's going to ask you to upload proof that you had coverage based on current work. Under normal circumstances, this proof is usually what's called Form CMS L564, which your employer fills out to say that you had coverage between these dates based on current employment. If possible, you should ask your employer if they can fill this form out online, or on their computer using a PDF editor or something. sign it, and then send you a digital copy. And then that's what you would upload. That document is what you would upload to prove that you qualify to use this enrollment period. However, this is understandably not possible for everybody. And so if your employer cannot fill out the form, then Social Security will want different proof that you had insurance from current work. And this could be, for example, a tax return that shows health insurance premiums were paid, or W-2 that reflects pre-tax medical contributions. And we'll talk a little bit more about that in a moment. But needless to say, this new online process was created, I think, just 2 weeks ago. So they're still working out some kinks, but if you recently lost work or insurance based on current work and you need Medicare and you need help enrolling, you can always call our helpline and we'll walk you through the different steps and figure out what's best for your situation. So perhaps this is not relevant to everyone who's connected today since we are over the internet, but not everybody has computers, has an internet connection. They may just not be comfortable enrolling online for whatever reason, and that's completely understandable. If somebody can't enroll online, they can still enroll through their local Social Security office. It'll just be done in a slightly different way. So first, you'll want to contact your local office. They're still accepting mail, even though they're not open to you coming in person. This website, on Social Security's website, has an online field office locator where you put in your zip code. And then if you scroll all the way down to the bottom, it should say what the phone number and the address for your local office is. Then you'll want to call the office and ask, how should I submit my paperwork? Do you want me to mail it? Do you want me to fax it? How are you processing paperwork right now during the public health emergency? Next, once you know how to submit the paperwork, you'll want to get the right forms together. So if you are enrolling in Medicare for the first time because you just turned 65, you'll just have to submit Form 40B, which is the application for enrollment in Medicare. And I know it seems a little bit official to be using these form numbers, but it's really important to be familiar with what they're called because it'll just help the process be smoother if you know exactly what the things are called that you're supposed to submit. As we discussed, if you're using the Part B special enrollment period to apply for Medicare because you recently lost work, you recently lost insurance based on current work, you'll also have to fill out this Form L564. Usually the employer fills out Section B of the form, but right now, Social Security is making an exception. You can fill it out on your employer's behalf, but just don't sign it. If your employer is not filling out this form, the request for employer information, you'll also have to include more proof that you had job-based insurance. And so here's the list of proof that Social Security provides that they say is an acceptable form of showing that you had job-based insurance. So in addition to an income tax return or W-2, you could show a pay stub with health insurance premiums deducted, a health insurance card that shows the policy start date, an explanation of benefits paid by your job-based insurance. So that's the form that you get usually after a health care service that says, the insurance paid this, you owe this, and then you'll also, get a separate bill from your doctor. Or a statement showing that you paid your premiums. This is not the only type of proof that Social Security will accept. We've seen people use a signed letter that attests to the dates that they had the insurance. But, this list here, if you do have any of these documents, would be good types of good proof of job-based insurance. Next, you'll want to mail in the paperwork. So if possible, we recommend using certified mail because it provides a receipt to you and confirmation that the mail was received. And having this proof of how, the dates that everything was submitted is helpful in case there are any enrollment issues. Someone couldn't say, oh, we don't know where your application went, we never received it, because you would have that confirmation that the mail was received because you sent it through certified mail. If you cannot mail your paperwork and you have access to a fax machine, you can also fax your enrollment documents to this number here, which is 1-833-914-2016. So it's possible that, because the Social Security offices are so overrun, so backed up with being closed, but still, helping people enroll and figure out all of their services, that your enrollment might be delayed. Maybe you're told it can't be processed. In addition to contacting our organization, the Medicare Rights Center, for more assistance, we've also seen success with people contacting their federal elected representative and asking for help from the Constituent Services Department to sort of push that through, or see what's going on, why things are delayed. Okay, last major concept for this presentation, and then we will finish up. There's a process called equitable relief that normally exists to help people who might have made an enrollment mistake because somebody from Social Security or someone from Medicare said, oh, you don't need to enroll, you can enroll later. And then the person finds out that that was actually incorrect and they missed their opportunity to enroll in Medicare. And now, they need to wait or can't get into Medicare as soon as they need it. Right now, the use of equitable relief has been expanded until June 17th to help people who missed a certain enrollment period because of the public health emergency. So these enrollment periods include the initial enrollment period, which is 3 months before, the month of, and 3 months after you turn 65. That's really the first time you are eligible to enroll in Medicare, and usually the best time to do so. You can also use this equitable relief if you missed the general enrollment period, which is every year from January 1st to March 31st. Or if you missed that Part B special enrollment period, which extends only for 8 months after you lose insurance from work.
Hi, can I ask a question? May I ask a question, please?
Sure.
Oh, thank you. My husband died of COVID about 3 months ago, and someone told me, we had a funeral for him, and someone told me, actually 2 people told me, that I should contact Medicare. It pays, I think they said, either $500 or $1,000 towards the funeral expenses. Can you tell me how I go forward in that manner, to achieve that end, please?
So I have not heard of that happening. I don't know if anybody else has. So I would recommend calling the 1-800-Medicare helpline.
They do not answer. They do not answer.
Yeah, I mean, I can put up the number for the helpline after this slide, I think it is.
Can you just tell it to me verbally? I'll try the number that you're giving me. I've tried another
Sure.
number.
So this is going to be for the Medicare Rights Center helpline, a nonprofit that I work for that helps with Medicare questions.
Thank you. What is it, please?
It's 1-800 333
333.
Yep. 41 14.
I'm sorry, 4114. So 333-4114. Is that the only number you have that might be able to help me in this regard?
So I gave you that number because the counselor who answers the phone, or if you leave a message and you're called back, would be able to do more research about the answer because I don't know it off the top of my head. I do think that trying to get through to the 1-800 Medicare helpline is the best way of finding out that information.
What is that number for the 1-800 helpline, please?
Yeah, it's 1-800-633
633
4227.
Mhm. 4227.
Correct.
Okay. Is there any other number? Because I believe that's the number I called. Do they typically answer?
It's hard to say. I think, people have more success in the morning before it gets busy.
Gotcha. Do you have any other number perhaps, or just that one?
Just that one. Yeah, I'm sorry.
Thank you very much. Thank you.
Yeah.
Thank you. Bye.
Yeah, so just quickly to continue going over equitable relief. Basically, if you were trying to enroll in Medicare for the first time, but you missed your first chance, whether you're outside of your initial enrollment period, you missed the general enrollment period, which ended on March 31st, or the 8 months after you lost insurance from work have already passed, you can request what's called equitable relief from Social Security to get more time to enroll in Medicare for the first time. So in order to do this, you'll submit your enrollment paperwork to Social Security along the lines that we just discussed. And in the remarks section of Form 40B, you'll write, I'm requesting equitable relief to enroll in Medicare due to coronavirus or COVID-19. Again, this opportunity to use equitable relief is currently only until June 17th. So, if you or someone made an enrollment mistake or is without Medicare right now or has questions about what might be covered, I really recommend calling our helpline to discuss that specific situation because there are a number of troubleshooting strategies that we can use to try and get a positive outcome or, the best outcome possible at this time. So we are a nonprofit that's not affiliated with Medicare, so we can't look into Medicare system or anything like that, but we have over 30 years of counseling experience in helping people with these sorts of issues. So it looks like we have about 10 minutes. And I can take any other questions that people have if you want to unmute yourself, but thank you for attending and for giving me your attention to learn about Medicare for so long. I appreciate your time.
Thank you, Emily, for your presentation. Anyone, if you have any questions, you can either unmute yourself now or you can also write it in the chat and I can read your questions. Or if you want it to be anonymous, you can also individually message me and I can read it that way as well.
I have a question.
Yeah.
I saw a doctor in April for actually just a regular sickness, but at the time I didn't know if it was a regular sickness. But when I say I saw a doctor, I did the teledoc.
Okay.
Because my doctor wasn't there, so I called urgent care and they told me to go through the teledoc and they gave me the number and all that. Anyway, the doctor said to me that he could see me even if I couldn't see him. And he gave me a prescription, very nice doctor and all that. Gave me the prescription, used the prescription. But even though I had the original Medicare plus a supplemental,
right,
they charged me $80. And they're telling me that it's because Medicare didn't cover that. Now, was there a specific time frame that I would have been covered for this, or is it covered now and it wasn't then?
Yeah, I believe it was, I think it's telehealth services have been the expanded coverage since early April.
Okay.
So I'm just gonna see, I think I might be able to find the answer for you. So I think, and the appeal reason was just Medicare will not cover this.
Right.
I mean, the denial reason.
Yeah. They said
nothing else. So helpful.
she said that I should call back, in
Mhm.
6 weeks. And I called back last week, and she said she has to send it to her supervisor so that they could get an answer as to why it wasn't covered.
Hmm.
And
Yeah.
the thought about it is they never said it wasn't covered when they were talking to me. But I kept saying,
Yeah.
why are you charging me $80? I normally don't have
Mhm.
anything like that.
Implement. So yeah, it's actually since March 6th, the telehealth services have been expanded. So I would recommend going through the process to, calling, but also if that doesn't get anywhere, filing an appeal. I know it's not great,
You know,
but to
it's
like
just
alert them that they made that mistake.
exactly, it's just so much because it's with them. Like,
Uh-huh.
everybody knows it's been so hard.
Yeah.
So I am going to call them again and see what they say about the billing. Maybe they'll just credit my account or something.
Yeah.
Okay.
And I mean, it's a very frustrating situation. I'm sorry you're going through it, that
Yeah.
it falls on the person getting the care to make sure that the rules are being followed. Shouldn't be like that.
Right. Thank you.
Yeah.
And thank you
Yeah.
for the presentation, by the way.
You're welcome. Thanks for coming.
Thank you.
Any other questions? Feel free to jump in.
This is Judy Grimaldi. I just wanted to thank Emily for pitching in and doing this. I had to be at another meeting, so I joined later, but I'm so glad you were here and that my Bay Ridge community made you feel welcome.
I feel very welcome. Yeah. Thank you for hosting the Medicare Rights Center.
We were thrilled to have you. Telemed, I think, is going to be with us even beyond this. I think Medicare is going to find that both it's cost effective and some of us really like it, that we didn't have to get out and especially for simple things like colds or a quick prescription. So
Right.
Emily, do you see this as being extended? Have you heard anything more about it being not just a COVID Band-Aid, but a permanent solution?
Yeah, so that's a really good question. A lot of these changes, the end date is sort of unclear, and I think it's going to be similar to the way they were put in place was a patchwork. When they end is also going to be at different times. And we've seen with telehealth that a lot of the changes have been beneficial to people, especially, those who can't leave their home under regular circumstances, let alone COVID-19, and just for the convenience of short visits, like you mentioned. Right now, we don't know what will be extended past the emergency period, and if things are extended past that end date that we don't know yet, for how long will they? Because I think, even after the emergency period is officially over, people are still going to feel a little wary about leaving their homes and still want to access telehealth services. So it's something that we're advocating for things to stay in place as long as possible, especially the ones that have helped people, while recognizing that right now it's sort of a wait and see. Yeah.
Emily, is there ways that we as the community can help advocate for this, or through the Medicare Rights Center do it? Because I think that it's something that we would want to keep permanent. And I know other, not Medicare, but others traditional insurance programs do allow MediHealth and do cover.
Mm-hmm.
So I was just wondering if you had any feedback on that.
Yeah, so I would recommend, we haven't had really any petitions recently through Medicare Rights Center for people to take action, but we do have, we post policy articles on medicarerights.org on our website. So I could send that to you after this presentation as a way of staying updated and getting on our mailing lists.
And could that be for everyone? I mean, is there some
for
way
everyone.
that could distribute it to all participants in this?
Yeah, definitely.
Workshop?
Yeah, so how should I go about that?
I guess if you send it to me, I'll get it to the administration of the Bay Ridge Center. And I don't know whether they've kept everyone's email who signed up for this, but if they did, I know this is going to be recorded, so maybe you should say it out loud in the recording.
Yeah.
So anybody who watches it.
Yeah. So the website to go to stay up to date on policy changes related to COVID and beyond is Medicare
Hello?
rights.org/latest.
Thank you.
Medicare.org/latest.
Emily,
Exactly. Yeah.
Yeah.
Oh, I guess I could put it in the
Emily?
chat too. Hi.
Flash later.
can you hear me? This is Emily.
Yeah, I can hear you.
Yeah, I don't know why I couldn't unmute on the laptop, but I
Oh,
called on the phone.
okay.
So anyway, I have two quick questions.
Sure.
The first one is that I did my COVID test last week, and thank God it was negative.
Glad to
So
hear it.
in the future, if I would want to take another one to navigate my travel, because I understand that it is not, the result is not forever.
Right.
The Medicare cover the second one?
Yes. Yeah. Medicare will cover multiple tests if they're, medically necessary. Yeah.
So one other question.
Yeah.
I have a Medicaid AARP as a supplementary insurance.
Yep.
That was enough. I had the basic, but with this emergency, to look forward, do you recommend that I should enroll with the Advantage over the AARP basic?
That's a good question. It depends. If the AARP basic right now is covering all of your doctors and it's affordable and, you're not having any problems with it.
So with your research, is the Advantage usually a better plan on the whole if my doctor accept it, is within network?
It's hard to say. Well, one, we try to stay unbiased, so I can't really say if one is better than the other, regardless of, what our personal opinions might be. But I think the way we frame it is, the best plan for you is the one that has costs that you can afford. It's not too expensive. All of your doctors are in network and you like those doctors. It covers the pharmacies that you go to. And your drugs are all covered and they're not too expensive. I think that's like what defines a good plan. What the company is or whether, you have original Medicare is really secondary to just making sure that your doctors are covered and you can afford the out-of-pocket costs.
Okay, thank you.
You're welcome.
One other question in the chat, Emily is asking if there is an email address that can be contacted if questions pop up, or is it just the phone number?
It's just the phone number at this time.
Okay, thank you. Are there any other questions while we have Emily here?
I just wanted to say that the young lady who spoke about the funeral benefits, she could call human services, I guess, for that. Can you hear me?
Yes, thank you.
Thank you. Yeah, I haven't heard of that before, so that's helpful to hear someone else with a resource.
Okay, well, if those are all of the questions, I guess we can thank Emily so much for being here today.
Thank you.
Thank you
Thank
too
you all.
for jumping on.
We learned a lot.
Yes, definitely. I have this recording going. I'm going to stop it right now.